Good day. Thank you so much for joining us. Today we're joined by Dr. Clara Kunyarimwe, who is our first guest on Beyond the Role, which is a platform where we're just inviting people from different backgrounds who are in different leadership positions for them to tell us how they walked this journey and how we can also bring data into their day-to-day work and how it has influenced their different decisions that they've made for their career, for their personal life, and for anything else. So I'll give you the platform, Clara, to introduce yourself as if someone were introducing you.
Thank you so much for having me here, Alice. And I am very excited to be a first guest. I hope that I will be a recurrent. No, is that the English? I don't know. The guest that keeps
Yes.
coming, that one. So my name is Clara Kunyarimwe. I'm a medical doctor. I am based in Zimbabwe. I am currently practicing in the mental health department, where I'm also a student in psychiatry. So on my way up to being a psychiatrist. I do a lot, hey, all over the place, and been in a couple of leadership places. I think ultimately the best leadership place I've been in is just being a leader for myself. So I
Amazing.
guess that's the one I'm going to be talking about a lot today, just how I've been leading and how that has been going. But that's how I want someone to introduce me.
That's amazing. It's great that you have now you're not then just a general doctor, you've now transitioned to specializing. I think my follow-up question would be, what inspired you to pursue medicine or to be in this space that you're currently in?
So pursuing medicine was because my mom wanted a doctor, so she pushed me there. It was not in my plan, not at all. But I'm glad she did because along the journey, I met myself. I met who I would and started seeing how the future was. And then what then pushed me to specialize was I've known since fourth year that I like psychiatry. So
Mhm.
I knew I was on the way.
Mhm.
So the opportunity just then came this year and I boarded and on a 4-year journey to being a psychiatrist.
That's quite
Yeah.
interesting how our backgrounds shape who we become in the future.
Yeah,
How at times
definitely.
you get into a space and you're just like, I don't want to be here. But then when you start walking the journey, you realize this is actually interesting. And this is quite a beautiful story
Yeah.
to tell, to say you turned your lemons into lemonade because now you actually enjoy
It,
it. And
yeah,
along
yeah,
the
yeah.
way, you said you have found yourself, which is something that is so profound because there are people who are in different leadership positions, who are in different spaces, who I think have also not found themselves. But in your early career, you're already on a path
Yeah.
where you are finding yourself and you're getting to learn things about yourself. Whilst we're on to that learning things about yourself, what is the biggest challenge that you're facing right now and how are you tackling it?
Biggest challenge. My biggest challenge right now is I think it's a curse to learn yourself, especially when the environment is not allowing.
Yeah.
I'll just tell you what I've learned so far and how I have somewhat packaged it.
Hmm.
So I've learned I am a leader. I've learned that I like making spaces function. I
Yeah.
don't want to do the work. I want to make the place better so whoever's doing the work can thrive in it. That's what I want to do in spaces. And I feel my calling is in the workspace. And in particular, I'm here to learn more, but in particular, I have a passion and a heart for my country. And I know everything's going down. And what's hard is just keeping the vision and keeping the passion in an environment that's broken. And you also ask yourself, am I really doing this? But that's where the dream is. And you can't abandon the dream. You can't look aside because the real you.
Yep.
So that's the hard part, just doing the work that you have to do in an environment that's really not accepting or accommodating.
Speaking of environments and how difficult or how hard environments can be, there's this term that always crosses my mind whenever I hear medicine or I hear doctors, resilience. It's a word that we hear most often than ever.
Yeah.
What does resilience actually mean to you in practice?
So I think it's diverse, and its diversity there is whenever anyone describes it, it comes down to the same thing.
Mm,
I think it comes from the word resistant. Just means that you've grown, like you've grown in the environment in a way. and you are, should I say, going against whatever's in the environment so that you keep going. So you've adapted and you're moving through even when whatever environment you've been given. I think that's how I'd say doctors are resilient.
Yeah, I see. You also face medical space. You also face people from different backgrounds, confirm. And
Mhm.
I believe that you're working for a public hospital, and the times you go to the private sector as well. My question, or what I would want to understand in that space that you're in, how do you maintain your empathy in the two different spaces, the public space and the private sector that you're working in? How then do you balance that empathy between people who can afford private health and people who cannot, who are like in the in public health? How do you balance you being the same person in both spaces, or you're a different
Yeah,
person
yeah.
in the different spaces? When you're in the public sector, you're this, and then when you're in the private sector, you're a totally different person. How do you balance the two, and how do you become the same person in the two different spaces?
Can I answer that in a minute? My dogs are
Yes.
crying.
All right,
That's fine.
let's go.
All right. So when you're asking, I was actually laughing because it's difficult to balance in the sense that patients, when they come to you, they come, besides the fact that one can afford, one cannot. They also come with an attitude sometimes. And you find that, especially with private patients. So even though they are affording, they really come with a bad attitude. So, well, not, I guess they're patients, so you can't say that, but an attitude that's not inviting your empathy. You just get into the consultation room and you want to leave. So they actually make it very hard for you to be empathetic and all that. But then the patients that can't afford, they're down to earth. They're
Mm,
so down to earth, and you can really see that they need your help. They respect you.
mm,
They understand your position. They want whatever you say, and of course they will say prefer A, B, or C what you said. But ultimately, I trust you because I came to you. But
mm,
then the other patients will come with their Google doctor. They are telling you what they want. They've already written prescription, and all you have to do is just put your name on it. And so, but one thing that has helped me in everything, and even when it's tough, is I always imagine a relative of mine in that person. If
mm,
it's an older person, I imagine my dad. If it's a
mm,
young man, I imagine my brother. If
uh-huh,
it's a young lady, I imagine my sister. And
mm,
I always think to myself, if this was my dad, how
mm,
would I have wanted him to be treated, in private or not in private? If this was my grandma, I really have a heart for older people because I didn't get to then see my grandparents grow old. So I always imagine, it's my grandparents. So I then give my all and I then put on the empathetic heart, and that makes it easy. So
mm,
whatever they bring, bad attitude, for lack of a better word, and everything else, then just gets swept under the rug because I then push forward something that holds more value to me.
mm.
So that's how I cope.
That's quite interesting, because I think it also requires a lot of patience as well, because they'll come with different characters and attitudes. And at times I'm also one of those patients who bring Dr. Google, because I've already Googled my symptoms, and
Mhm.
Google had already told me this is what you're suffering from. So when you're telling me something different, I'm like, oh, please, where did you study your medicine?
Yep.
So that is quite helpful. Thank you for bringing in that. My other question would be, what's the most common myth or misconception about doctors you wish people understood?
We can't remember everything, guys. We're just humans. We learned the skill. We
Yeah.
know, like, we know where to start. We
Mm.
don't know everything. Yeah. So please give us grace to say, I'm thinking this, but let me just confirm the dose. Because you want a doctor who's certain by confirming. My professor back in school would always say, when in doubt, consult. Consulting can be you're consulting a senior, you're consulting a textbook, you're consulting a medical application, but when in doubt, consult. But
Mm.
trust me, my doubt is not going to be from a zero, it's just a 50. So we don't know everything, but we know where to start.
That's a great lesson, because I think it can be applied anyway. When in doubt,
Mhm.
consult. Can be applied in any space. So that brings me to my other question on the linkage of data. How, or if you have ever been in a situation where maybe what you know and the data that is on the ground are two different things. How do you bring a nexus between what you know and what's on the ground being different? How do you bring a nexus on the two sources of data?
I may need to re-clarification of what I know as in the knowledge I have and what is on the ground in patient management or in anything.
In patient, it can be in anything because we're looking at this is the data that has been presented to you, and what you know and the data that has been presented to you are two different things. So how do you bring a nexus or to bring them together to make sense if ever you faced such a scenario?
I think I've had it in the other way around. Let me just try and see if that answers. In the sense of what you know and what you've learned, let's take medication, for example, because you are in an environment that does not have everything.
Yeah.
But when you study or when you learn first world-class things. The books you read
Mhm.
are from America. The books you read are from countries that have done studies. They tell you that this is what works. You encounter this, you are supposed to do it this way. But
Mhm.
now you go on the ground and then you have something totally different. And
Mhm.
now you have to then use the information you read, the information you has been studied to work in an
Mhm.
environment that is different, an environment that is maybe less or that does not have what you have. So now balancing that, you then might have to go with, you know what, I'm going to use what's here.
Yeah.
Might be the best, might not be what's currently available,
Mhm.
but to find a way to adapt to what's on the ground and to see how you can then write your own narrative to say, this is what we're told, but this is what we have, and this is how it's working for us.
Mhm.
And
Interesting to know that doctors are also adaptable.
if you were to walk the walls of our hospitals, you'd be like, aha, you're quite impressive. You're out there innovating things. But yes, we do.
While we are on that, can you share a project or initiative that you're most proud of, and what is the impact that it did in your years of
Um,
practice?
okay, not a project, it's an initiative.
Yeah.
I was working in pediatrics casualty.
Yeah.
They changed our roster and it wasn't great. I opened a group, invited my colleagues, and started talking about how the working conditions are not great
Mm-hmm.
and started encouraging everyone to leave and to look for better.
Yeah.
I think was a good initiative because I told people these conditions are not great and we
Mm-hmm.
can do better.
Mm-hmm.
So it was four of us and we were covering the morning shift. And by the end of the year of just communicating, having meetings with our bosses, trying to show them, okay, can we do things this way? Who left? Two of us went back to school. My
Mm.
other friend, a better job, paying like 100, maybe 60 times what we're being paid at that job. And
Oh, wow.
yeah, in the same country, like degree in a better place. So it was just nice to put people together and be like, this is not working.
Mm-hmm.
What can we do to be better and to leave this? And we all left the same times. I think it was a good initiative. Just looking at our value and be like, no, we're gonna give ourselves elsewhere. And I'm proud of such things because, like I said earlier on, I like efficient, effective places. And
Mm-hmm.
I like bringing that to a space. So when a space is not absorbing that part of me, I can't stay and I'll leave and I'll take people with me. So so
Wow.
I think that's cool.
Wow. That's pretty cool. It's also bold, I think, because
Yeah,
then just waking up and deciding this place making me grow. It's shrinking me instead of
yeah,
making me grow. So I better
yeah,
leave. It takes boldness and that willingness to say, oh yeah, I'm going to do this, and you actually do it. I stay
yeah. It's a
until
small
probably
thing,
I'm
but
worn out. And then after that, that's
yeah.
when I'm like, oh my gosh, I'm worn out now. And you don't have anything more to give. So I think it's actually great advice to say, whenever you are in a space where you feel like it's not giving you that opportunity to grow or it's shrinking you, it's very advisable for you to step out and to find other places where you can grow and where your experiences, your qualifications can better be used. Kudos to you for that. with some of these decisions that you made in your career, who has been your most mentor and what did you learn from them? Do you have any?
Yeah, so I think I've had mentors as thing where you meet people as you rotate, because initially we rotate quite a lot. So
Mm,
different people, without you realizing that they're mentoring you, they speak
yeah.
different things into your life.
Mm.
Recently, I then learned from one of my decision, but you're young, you've got the
We
energy,
lost
you've
you
got the
there, sorry. I think it then when we lost you. You were saying recently you learned
my back
from,
now.
yeah, you're back now.
No, I was saying that I recently learned that young people are afraid to make mistakes.
Mm,
What he said, I was talking to him about something, and then he was like, "But the problem with you, younger generation, is you're so afraid of making a mistake."
we've lost her again.
To stop one of my jobs, because I had like jobs at the time, or to take a break. And then I was like, to my mind, myself, what if it doesn't work? Then I heard him say, like, you're afraid of a mistake or a learning curve, just do it.
Mm-hmm.
Try it.
Mm-hmm.
He believes that it's better to have a oopsie than to have a regret. So
Oh, yeah.
yeah, I'm not oopsie. Yeah, that's what I learned.
See. So it's better to have a oopsie than a,
Regret.
because you
And then
never
like
know
you look
until
back
you
and like,
try.
I wish I'd done this when I was 30. Did it and yeah, I got burnt, but I did it.
You
Yeah.
never know until you try, yeah. That's quite interesting. My question was, what advice would you give someone who's starting out their medicine career or who wants to pursue medicine? What advice would you give to such a person? Or what advice would you give to your younger self?
Ish. To be honest, I would encourage them to be accountable to someone.
Yeah.
I'd encourage them to be accountable to someone. I would encourage them to have a good network of people because the journey can be difficult.
Mm,
But you want a good network of friends that can encourage you when things are not great.
mm,
And you also want, and accountability can just be even a senior person, someone who's 2, 3 years ahead of you,
yeah.
someone who's walked the path. It always makes it easier when people tell you, you know what, I had do a timetable this way because it's the small things that help.
Yeah.
So I biggest thing would be accountable to someone, whoever
Mm,
that person is, and let it be in a holistic manner, accountable, studies accountable, even in your physical, where you're going to be working out, exercising, everything. Just be accountable to someone. It will definitely make the journey.
makes the
Yeah.
journey easier. Journeys are always easier when you have people
Yes.
around you,
Yeah.
people who have walked the path before.
Mhm.
Can you complete the sentence for me before we get to the fun segment? I'm excited for this one. Beyond the role means dash dash.
Ah, I don't know.
Success beyond the I'm a medical doctor or I'm a mental health doctor.
Mhm.
Success beyond that role. What does it mean?
That one is easy. It means knowing who you are and
Yeah,
doing it. Yeah, and the real you, because the real you is not the medical doctor. The real you is
yeah.
not the psychiatrist. It is what you do.
Mm-hmm.
The real you is, that to your fullest. Doing that in a way that if that person you saw will go home and be like, I spoke to this kind doctor who was patient,
Yeah.
who, and they'll go, thank God for you. That's what
Mhm.
I think success is, just knowing who you really are and giving that. And then the rest will be history.
Amazing. Be the role you true to self. So success beyond the
Yes.
role means being true to self.
Yeah, the purpose, finding it and leaving it and being true to it.
Hmm.
Yeah.
Thank you so much for the profound nuggets. Now we move to the fun segment where it's one word answers, it's two, three sentences, however you want to respond to them. Then just go fast. What's the funniest mistake you made in your very first job?
I inserted a catheter in the wrong hole. I
Wow.
did ask. It was a female. I was supposed to put it in a vagina, in a urethra. I put in the vagina. Moving on. I corrected it.
Can you describe the most surprising thing that happened in your first week, if you still remember?
Surprising. No, I don't remember.
Okay, can pass it. If money were not an object, one job you'd try for a day.
Being a truck driver.
I've always
Because
wanted job you had as a kid and what's you wanted to have as a kid and what was the best moment?
the job I wanted to have as a child,
Mhm.
to be a house help, a maid.
If you could, wow, like house help to medicine, you're still helping people.
Thanks.
The
Just
common
differently.
denominator is helping,
People, making people's lives not comfortable and
making
easier.
people's lives easier and comfortable. True that. If you
Yeah.
could trade places with any fictional character for a day, who will it be?
Oh, Wonder Woman.
Woman.
Yeah.
Why would that be? If there's a reason.
The name. She Wonder Woman. Big things, guys. Yeah. Woman.
One job you'll be terrible at.
Motherhood. That's a job, right? I think
No.
yeah, that one.
Okay. Would you rather be famous or anonymous in your field?
I want fame.
You
I
want
want
to
the
be
world.
famous.
I want to be known. I'm going above and beyond the world's gonna know for the right reasons though.
For that disclaimer because I'm like, what do you want to be known for?
All the
Good things. We love that for you. Would you rather have a perfect memory or be able to see into the future?
I'd want to see into the future.
Interesting. Would you rather take a lot of small risks or one big risk in your career?
I think a lot of small risks.
Just small bits.
Yeah,
Oh,
snippets of risk. Hmm.
nice. Rather lose all your work on your computer or have to listen to the same song on repeat for a month. Not your favorite song, that annoying song.
I'll listen to the song. Sorry. The work you go through referencing through reading journals,
Yeah.
listen to the song. Play it on loud even with bass. I'll listen to this.
That's so
So interesting.
this was so much fun from you and also getting to understand that beyond you wearing white coats and being a doctor, there's also like a human being in you beyond you juggling school and even you mentioned three jobs. There's a human being who's fun,
Yeah,
who's there. So
yeah,
thank you so
yeah.
much for sharing that. Last question, I think, before we close, will be any question that I didn't ask you that you wanted me to ask. You can answer.
Yeah, actually.
Hmm.
I want to make money as a doctor. Yes. I really want the money. I want the knowledge to pay me. I don't want to be a poor doctor.
You don't want to be a poor doctor. You want to be
Would
the.
I go for money or purpose?
Hmm.
Like go for more, like a job with a lot more money,
Hmm.
job with just enough, but feeling like I'm serving my purpose. I'll go for one that I feel like this is me, this is my purpose, and it just has enough, even though I do like money.
That's interesting. Those are interesting questions. I think I should just add them onto this podcast. Would you rather go for money or for your purpose? Would you rather go for,
Mhm.
you won't get to self-actualization when you don't have both. Self-actualization is having both.
Yeah, you need both. But they say that gift will open up before kings. Hopefully, yeah, those tend to be true.
Yeah. And I also hope that that whole mantra of you learn to earn will also get us to somewhere. So we are still
Right?
on the learning phase and hopefully one day we'll be earning.
Won't die on the hill of learning. No, thank you so much. It's been so much fun having you, not having you, but you having me and answering your questions. Yeah, you.
Really enjoyed the conversation. And as you said, you're welcome to reach out and come back for another
I'd love
segment.
to.
This is so much fun. And thank you so much for heeding to the call. And share your story and be vulnerable with us and to tell us your journey and to share the challenges, to also share with us your successes, because from this whole conversation, you were not shy of sharing even the challenges that you have faced or the things that most people just want to share the glittery side of
Yeah.
things. So thank you for being vulnerable enough for you to share with us all this and looking forward to having you on
Yeah.
another
It was my
episode.
pleasure. Thank you so much
I'm grateful
and enjoy the
that
rest of your.
you became one
All
of
right.
our first guests and
Yeah.
thank you. Have a great evening.
Yeah, and have a great afternoon.
Cheers. Have a good one.